Hey everybody, it's me, Casey, and I am back. I'm not cooking. Um, I'm still recuperating from my surgery that I had. I had C5, C6, C7 cervical disc replacement. Um, I'm getting there. Today is day 10. It was kind of a rough ride, honestly. I'm starting to feel a lot better though. I'm up and around. I've been doing a little few things around the house. Um, and I got another appointment scheduled for Thursday. Today is Sunday. Um, and hopefully they give me some good news and release me to drive again. It's kind of tiresome and boring to be in the house forever. You can only watch what so many movies on Prime Video and Hulu and those things. So, and most of the time I was knocked off sleep from medication anyway. But I still have the medical covering is some type of little strip that they say will fall off. I actually took off the bandage that I had up there. I'm allowed to allow this to get some air. I don't know how they're gonna handle this if we get to the doctor's appointment and that's still there, because I'm not gonna do anything to try to pull it off. So it hasn't fallen off. We're gonna just see what happens, and we'll just see what happens with the doctor's appointment. I was having trouble with pain in my neck, pain going down my shoulder, all the way down to my elbow. And like I said on my earlier video, I never knew an elbow could hurt so bad, and I didn't know what was going on. I thought that it might have been arthritis, but then it went all the way down my hand here through my wrist, and it went to these two fingers. That was on this side. These two fingers. That was on this side. And then on that side, I had a tingling feeling, tingling all the way down. And I had gone to the doctor for it. I was being treated at the pain clinic, probably close to 2 years. I had injections, cortisone injections, I guess, and I was taking muscle relaxers. I was taking, some pain medicine, nothing real serious pain medicine. And just things never got right. I started not being able to sleep at night. I was tossing and turning. It got really bad. And then I had an MRI, and I was told that the results showed that every disc in my vertebrae was affected. I either had bulging or herniated, and I was out of work for a while. And I also had uh, just a lot of pain, but I had the pain doctor finally referred me to the surgeon, and they did some x-rays and they did some things, and they came back and they said that I had bone spurs on the outside and the inside of my spine. And the doctor, he said to me that he was surprised I wasn't complaining of a sore throat, because I had bone spurs that were apparently like right in here somewhere that was cutting into my throat, is what he said. And I thought about it, and I had been having issues swallowing one of my medications, because I take, some medications, a lot of vitamins and stuff, two prescription medications, a lot of vitamins, and one of them is fish oil. And they come in that round capsule, and the capsule is usually pretty good size. And I started noticing that I just couldn't get it to go down because it hurt. And I had decided that I was going to see my own regular physician, my own primary, because of that. So when he said, "I'm surprised you're not complaining of, a sore throat," I looked at him and I said, "Well, actually, I have been having problems with my throat. I haven't been able to swallow. I had to, stop taking one of the medicine because, I was having so much trouble. And I was going to see my own primary care physician about it. But I hadn't made any kind of appointment." He said, "Well, there's no need, because what's going on is related to what's going on with your neck, and you need surgery. And the sooner the better." So I wasn't going to argue with him. And it was a Thursday. He actually wanted to do it the next day because he told me he was having, he was doing the surgeries the next day. And, he said if I could find someone to come be there with me, at the house with me after the surgery, get me to the surgery, be there at the house with me for a few days after the surgery, that he would perform it the next day. But I couldn't do that. I couldn't get a team together. I had a great team, I have to say. I had a really good team. My daughter came, my two nephews came. I have one of my neighbors that was back and forth. I got a little friend that was, back and forth. And it all went good. Um, it was kind of rough. It's still a little bit rough, but it's been kind of rough. It's been, like I said, this is day 10, and I'm still having some pain. I feel like something is tearing back here. When I lift this arm to try to do anything to my hair, I feel it back there, and it feels like something is tearing. But I guess that's probably all normal. I'll find out when I get to the doctor on Thursday. But other than that, I'm happy to be back with you guys. It's probably going to be still a while before I be in the kitchen, cooking up wonderful things for us. I'll let you know because I plan on coming back again and updating you guys after my doctor's appointment and let you know how all of this went, because this is a process, and there's a lot of people out there that probably, need this surgery and don't even know it yet, because I had needed it for a long time and I had no clue as to what was going on. I thought that it was arthritis. I thought that it was, different things. But now I'm through it. I'm still in recovery. I probably got a couple more months to be fully recovered, and I'm waiting for that to happen. It's early spring. I'm hoping that by summer that everything will be good. I can start traveling again, and I can get out and enjoy life again. Cause it's been cold. I've been went through this during a lot of the winter months. And I've been in the house because it was cold. Haven't really been out going anywhere, doing anything much. We got the COVID. I mean, it's COVID. So I'm planning on getting my COVID shot soon. Hopefully the doctor will agree with it. I'll let you guys know what happens after I have my appointment with him. And I want to go and get that done, and get my first one, then go get my second one, and then follow all the precautions. But I want to start living again. I want to take me a vacation. I would love to go on a cruise for about 7-8 days. That'd be nice, just to get away. But I want to do everything safely. I want to do everything COVID safe. I want to do everything my injury safe. So it's one day at a time, guys. And that's the way I'm going to take it. I'm going to take it one day at a time. I thank you all for hanging out with me. I thank you all, my dedicated people that's there for me when I'm cooking in the kitchen. I did cut all my hair off. So I might look a little different from what I did, sometimes back, especially when you saw me cooking in the kitchen. I like it like this. There's really nothing to it. It's wash and wear. You just, get up in the morning, you wash it, and I got a little oil or something I put on it. And, just fluff it up, and, I'm ready to go. So, again, guys, I love you guys. I miss you guys, miss cooking with you guys. And I'll be updating you again probably in a week or so to let you know how things are going. Anyone out here that needs this surgery, I was afraid. I don't want you all to be afraid. Go on and get this done and taken care of. It's probably going to be a little challenging at first once it's over, but it's probably going to turn out to be the best thing that ever happened to you. I'm looking forward to, the great adventures that await me. Thank you all. I love you all, smooches. This is Casey, and I'll see you again. Bye-bye.